in a woman who's carrying this gene mutation. Now, there's also a chance of getting a second cancer. So if a woman has had a breast cancer, what's the chance that she's going to get another cancer? It goes up dramatically. That's what each of these blue lines show, that if you've had breast cancer, you have a 16% chance of getting ovarian cancer. If you've had breast cancer, you have a 27% chance in the next 5 years of getting another one. And if you've had ovarian cancer, you have up to a 64% chance of getting, anyway, very elevated. So it's, you don't get one cancer and then you're free. So even for women or individuals who already had the cancer, there is quite a dramatic increased risk of getting another cancer. Does it affect anything else? Well, the big one here, but it's going to look more dramatic than it is pancreatic cancer is up, especially in BRCA2. But look at my scale here. This is only 1% of the population gets pancreatic cancer. It goes to 2% or 4%, not 87% like we saw with breast. Colon cancer, also look at the scale. It's elevated. It can be up to about a 10% risk, although the lifetime risk of colon cancer is higher than 2%, so I think that's a little bit wrong. Okay, and men. Do men get affected by this gene? Well, actually, the colon cancer and pancreatic that we just saw are affected. Prostate cancer risk can go up, but prostate risk is high already. And this is also an underestimate of the risk of prostate cancer. It really goes from about a 12% risk to about a 16% lifetime risk with prostate cancer. And the lifetime risk of breast cancer in men can go up to 6% with BRCA2 only. Now, the reason I show you this slide is because it's important to realize that all hereditary breast cancer is not due to this gene. Today we're talking about this gene, but most of the time, if you have a family history of breast cancer, it's actually due to some other kind of genetic process. And that's what this dotted blue line in the middle shows you, that if you have a family history but it's not due to the gene, the lifetime risk of breast cancer is elevated, but it's not nearly as profoundly elevated as the purple line that is associated with the gene mutation. All right, so when should we suspect it? Well, the features are listed on this slide. If you have anybody in family with breast cancer under the age of 50, it's a red flag for this gene. If you have anybody who has ovarian cancer in the family, it's a red flag for this gene. If they have multiple primaries, so we already talked about what multiple primaries mean, the list of cancers that we already went through. Male breast cancer is so rare that if we see it, you should always think this gene might be involved. And having an Ashkenazi ancestry profoundly increases the likelihood that any of these features are associated with it. If you have a relative with a gene mutation, that's a given. Now I'm going to come back to that in a little more detail. But it's also important, this is what I hear every day in my clinic. It is, if you remember that drawing, I'll show it again, it is equally likely that you can inherit this mutation from the father's side, from the mother's side. You know, I've been doing breast cancer since I was training, and so we're going back into the 1980s, and we never took family history for cancers, for breast cancer. We just didn't know it mattered, because all of the models said it really needed to be a first-degree relative. So now we've learned, because it's a gene, it certainly can be passed through the father. In fact, it's absolutely just as likely to come from the father's side as the mother's side. A lot of us don't even know our paternal family history on these diseases, and certainly many people fail to record it, even people who are taking histories. I take those histories, and there are patients who've been referred to me because their doctor took the history and no one asked them about their father's side. So it's really a critical area to understand that it's equally likely, and so